Good afternoon. Well, welcome everyone to our City of Little Rock Board of Directors agenda meeting, setting the agenda for September the 1st. We're first going to start with a brief presentation from Mr. Greg Thompson, who is our CEO of the MIMS organization.
Thank you, Mayor.
Before he starts,
yes,
we need to honor Mr. Thompson. He has just published his first book about all of the things he's learned from being a paramedic and probably about helping rebuild the first boardroom over there at MIMS. But it just got published, and I think we need to be pleased with him.
Well, thank you so much for that acknowledgement, Mr. Carpenter and Mr. Thompson. We look forward to reading your book.
Thank you, sir. Thank you, sir. Council, I appreciate you letting me be here tonight. Just to remind you that MIMS is a public utility of the City of Little Rock. I find that when I tell people that many times that a lot of folks don't know that about us, assume we're private and so forth, but non-tax supported partnership between Little Rock and North Rock and the county that happened back in 1984. What I'm here tonight to talk to you about is something that's going on around the country and its effects on us here in Little Rock. This has been going on for a while. It's been happening in the country since prior to 2000. We started seeing it happen here during COVID, and over the last several months it's gotten worse. Specifically, I'll tell you what I'm talking about here. So this is what normally should happen, is that an ambulance will go to the hospital, and within 30 minutes is the standard that we'll drop off our patient, and then we will go back in service. That's the typical way that it's worked, and it's worked that way for years. Every once in a while you'll have it go a little bit longer, like you'll have a trauma. There's lots of things that could cause it to take a little bit more time, but on the average, that's the way the system works. But started happening in 2000, and again, it's gotten much worse, and I'll show you some statistics over the last few months, is that whenever we get to the hospital and the patient stays on the stretcher, and then the crew stays with the patient, and the ambulance stays at the hospital. So what happens then is that the truck is physically at the hospital, but operationally it's out of service. It's not available for anything else. And so when those trucks get tied up like that, it can be a real significant problem for us. And so why is it that a patient can't be taken off at a hospital? What are the reasons that would keep you from being able to carry a patient in and drop them off? And here's a few things. One is boarding. So boarding is patients that have a bed upstairs, but for whatever reason, that bed upstairs is not ready, and so the patient is boarded or cared for in the ED. It'll show up here in a minute, but I'll tell you here that many times an ED may have, and I'm speaking generally because not about one specific hospital, but I'm thinking of a hospital when I say that may have 40 ED beds, but on a given morning, there may only be 10 of those available to regular ED patients. The rest of those are taken up with patients boarded that are waiting to go upstairs, so there's not the available bed. Regional demand is a big thing. With all of in the news, we're seeing all of the rural hospitals shutting down, and you're seeing some of the major hospitals here in the city buying up those hospitals. There's specialties that are not out in the state anymore that are now here. So what's happening is Little Rock is receiving those patients from all around the state. So that's become a big issue. Surge is a big thing. You'll have those days for whatever reason a big surge happens. And then, of course, staffing. High acuity patients that take a lot of time. Behavioral health, this is a big one. For behavioral patients, we've changed this. I'll show you this in a second, but behavioral patients take a lot of time because they have to be monitored. Somebody has to look at them. They have to be evaluated. Then there has to be a bed found for them somewhere in the state. And so that's a big one. Hospital flows and the bedroom availability. So those are some of the reasons that we can't get those patients off the cot. And so again, they're not available to us. So wall time, whenever we talk about that, are hospital delays. Two buzzwords that you hear us talking about is wall time is the time from minute 31 forward. So we give the hospital 30 minutes to get the patient off the cot. At minute 31, we go 1 minute. Minute 32, that's 2 minutes. That's important when you look at the amount of time that we're talking about. And this is a slide. We had our board meeting today at MIMS. We show this every month, and this was our latest. And so if you look in July, the orange line is the lost unit hours, and the blue line is the number of calls. So what happened in the month of July, a record was broken at 853 hours, accumulated 1 minute at a time, of extra time that ambulances were stuck at hospitals and not able to get out. And so I'll show you some of that here in a second. So 850 hours, and that affected, 2,481 actual calls that we couldn't get out. So 850 hours is the equivalent of 71 12-hour shifts. Now, the problem is it doesn't happen. If you saw it that way, you're like, it's just 12-hour shifts. I mean, 71, a couple of them a month. But that's not the way it happens. When it happens with a surge. So I'll give you this quick example here. So things are maybe going through the day, but let's say at 2 o'clock, 3 trucks transport to hospitals, and they're going to get stuck. And so at 2:30, the next people show up with 3 more trucks, but those first ones hadn't got out. That's 6 trucks tied up. And then at 3 o'clock, if we're still holding for an hour like it's been happening to us lately, up to 4 hours in some cases, then now you've got 9 trucks out. So 9 trucks out of a system in Little Rock that typically runs Little Rock, North Little Rock, 25 trucks. So now you pull 9 out that you don't have access to anymore. And then you'll see at 3. So you kind of see what begins to happen. So whenever it does hit, it seems to hit hard all at once. And then and for us to try to find our way out. This is a quick picture of that. There's not picking on this particular hospital. I could do it at other hospitals. I just happen to have a picture of that. But you can see how far they're lined up if you recognize that hospital all the way back to the street. And then if you look right in there, there's even some on that picture on the right to the left that you can't see in that. So you can imagine what's happening there. Some of those crews in the very back have not even gotten out yet. They're having to wait to be able to get out of the truck. So that's what we're talking about here. So what are we doing? And that's where I'll get close to finishing up with you now. Is there's a few things, and I was going to come speak to you guys a month or so ago, and we were not able to make it all work. But we're working not only with the hospitals, but we're trying to find a way to better manage healthcare, especially post-COVID. One of the things we've done is hired a social worker. I don't know of another EMS service that's done that. We're working hard with the city of Little Rock, specifically the police department, and then also with the social workers at all the hospitals. And so we're working on what we call our high acuity patients, HUG patients. And remember, you got a letter from the Public Safety Commission who sat through that presentation that, if you remember that, sent a letter saying they really supported what we were doing there. So we're trying to deal with those folks who have no other option but go to the ED by connecting them to services that take them out of that mix, so that frees up a bed. We're doing direct admit for behavioral patients, something new we're doing, the first in the state to do that. So we've got the hospitals, and it was a big thing to work on, but the behavioral hospitals have agreed to let us vet the patient. And then we're using an app that we communicate with the behavioral hospitals. They'll accept the patient, and we go directly to the behavioral hospital. So that saves the ED and the second transfer that would go with that. This is one that kind of bothers some people, but it's the right thing to do, and that is to direct a triage protocol. Meaning, if we pick up somebody who's low acuity, and there's not a bed for them, but they're low acuity, and they meet the protocol, we will carry them from the cot to the waiting room of the ED, and that's where they will wait. And so you can imagine we pick them in an ambulance, but go to the waiting room, but if it's low acuity, that's where they're going now. Extra cots, this has been a big A-bomb, and this is something we just started. And that is because the numbers have gotten so bad. If we need that ambulance back, and it's reasonable, meaning that patient doesn't have to have treatment right now, that we will tell the hospital after 30 minutes, here's a patient report. We will lower the cot to a safe height, and we leave. We'll get an extra cot, put the truck back in service, and keep going, because we cannot leave those trucks tied up like that. We've added additional staffing to manage transfers. We have our own school. You may not know that MIMS is a satellite campus of Pulaski Tech, so we have an EMT school and paramedic school that are constantly going to keep that. We work with the hospitals as partners. I'm not here to talk bad about hospitals. We work really hard to stay in the system to try to find solutions. I'm not laying all the blame. I'm saying that we have a healthcare issue, and it's going to take all of us to work through this. We've expanded to basic life support. It's a statewide issue, and I'll tell you one other thing, and I got one thing in my last slide, is imagine a rural ambulance service coming into the city, and they have 2 trucks in their county, and they get a truck into Little Rock, and they lose it for an additional 2 hours. Can you imagine what's happening in that community back that only has those 2 trucks? And so I'm on the board for the Ambulance Association. I will tell you it is a huge issue for the rural providers right now. So the bottom line is that when an ambulance at the hospital is just not available. And so I wanted to make you aware of what's happening with that, but also I thought a lot about this part here. How do I leave you? I don't want to leave you with a sense of, oh no. I want to tell you this is something we've been living with since COVID, but it has progressively gotten worse. We've pulled some things out, again, lowering the cot and those kind of things that we are pushing hard right now, that we've drawn a line in the sand. It can't get any worse from here. We've got to stop this. But I wanted you to be aware of it, so if you hear about it, you'll know what's going on and know how we're addressing it. Mayor, that concludes my report. Any questions for me?
Thank you, Mr. Thompson. Director Hines?
Greg, thanks for doing this, and just everybody on the board, I serve as the liaison to MEMS, and this has been a growing issue. We talked a lot about it this morning at the MEMS meeting, why the big spike up, trying to kind of find root causes, and as we talk about, Greg Stubblefield, who's the president of Baptist Little Rock campus, sits on the board. We always have a rolling member on the MEMS board that's from one of the local hospitals. It was previously St. Vincent's, now it's Baptist. I'm sure the next go-around will probably be UAMS. So we do work hand in hand with them, and they're having some of the same struggles we are with staffing. Our issue's not as been much staffing, but getting our trucks back on the unit. But sometimes we get to the ER and they can't open any more ER beds because they don't have enough ER docs or nurses working at some of the hospitals. So it's kind of something we're seeing, a lot more utilization, and you can see from the graphs a big spike up from, I think it was April to May or May to June when we started seeing it, and there's not been a real good reason why, but we're working to do it, and we want to make sure that we let everybody know we do partner really well with our hospital partners, and it's we're going to have to, as they say, teamwork makes the dream work. So we're going to work with them and continue to do it. But Greg's had to kind of pull out the, I guess he'd call it the A-bomb or the nuclear option with lowering the cots and leaving, because we don't want to put somebody else's life in jeopardy because we can't respond to a call.
Right.
So, thank you.
Director Miller? Thank you, Director Hines.
Thanks, Mayor. And thanks, Greg, for the presentation. I had no idea that this was going on. Let me ask you, make sure I understand. You have 25 total trucks.
Now, I have 62, but at a particular time of day, I'm glad you asked that question, a great question, by the way. During the peak of the day, so ambulances kind of, they ramp up as the day goes on, and historically when we have the most call volume, and they go down at night when we have a lower call volume. So right now in Little Rock, North Rock, 25 is the peak average right now, but 62 total trucks that we can put into the system. And we have added trucks to this, but it's just one more truck that gets stuck.
Okay, so make sure I understand that any one time, depending on the time of day, you'd have 25 trucks at your peak. Is that what?
In Little Rock, North
In Little
Rock.
Rock.
So a peak for us, a system-wide, because MEMS, as a public utility, we do cover the bedroom communities of Little Rock. So system-wide, 36 trucks is probably the peak of the day.
Okay, thank you. And are you going around to North Little Rock City Council, Pulaski County, Quorum Court, some other entities, sharing the same presentation with them?
So you're my first stop.
Okay.
Little Rock Ambulance Authority, you're my first stop. I do attend the mayor's staff meeting in North Little Rock every month, and so I have presented to that group, but I've not presented to the Pulaski County yet.
Is that, you plan on making this presentation?
Well, I'd love to. And with the thing about part of it for us, like having Lance here, so whenever I present to our board has representatives from those boards. So that's how I'm here. Lance, as the connection to this board, brings me here. Then we have a connection to the Pulaski County Board. So those are the ones that open the doors for me to go in. So as soon as they open those doors, I'm there.
Oh, okay, so then, because everybody needs to know about this. The communities that you serve, from Sherwood to Maumelle to all, I'm not trying to create more work for you.
That's all right, though.
But I think the more people understand what this issue is, maybe the more minds can think maybe what we can do about it. So thank you for that. Appreciate the presentation.
Thank you, Director.
Thank you, Director Miller. Thank you, Mr. Thompson. We appreciate you.
No problem. Thank y'all.
All right. Members of the board, as we look through the agenda, any questions on?
Mayor, there's one issue as I go into the agenda that we need to bring to the board's attention. There was a decision last week not to allow a particular development, and it was a short-term rental. It was zoning issue 10303. The applicant was not here. It turns out that there was some miscommunication on both parts, and the applicant had let it be known that they could not be here this week and was asking for another date. I'm going to ask one of the members of the board to announce that they would do a motion to expunge the vote on Tuesday. If you do that, it will take a simple majority. And then we need to expunge that vote and let that matter be heard again. I'm not telling you that anybody needs to change a vote, because that's really your issue. The question, though, is if somebody has gotten caught in a process, do we want to spend 2 or 3 years wondering if we had to give the hearing, or do we want to just give the hearing and take care of it now? And that's what I'm recommending, and hopefully one of y'all will say, I'm going to move to expunge the vote on Tuesday, in which case we can get the thing back in order. Also, the mayor and the city manager have agreed that we're going to have IT, and I don't know what this means because after email I'm kind of gone, but we're going to have a site on the website for changes in the agenda that would notify the mayor, the manager, the city clerk, and then the department heads, so that if something comes up, then those that have an interest in it will know about it immediately. And it will not just be one lost email, it would have to be 12 lost emails before I ever have to say this again.
Thank you, Mr. Carpenter. Board members, any questions on the consent agenda? Any questions on the set? Director Hines, and then we'll come to Director Peck.
So, and I don't know if this is being done through Kevin with our CDBG. So I see we got resolution 3, 4, 5, and 6 to purchase lots. So we're using, can you give us a little rundown on what and how we're doing that? And we'll be able to get clear just the title process, because I'm assuming that these are some lots that have not been, we've got a lot of building going on in Walnut Valley and Colony West from the tornado, but I would imagine that these are, or is this these ALLR, one company that's bought up all these lots? So just give us a little explanation.
Yes, so we're using CDBG DR funding. That's the disaster recovery funding that we receive for the tornado in that area. Those lots that we are purchasing is 2 lots that we offered to purchase. The 2 lots appraised out at $60,000 apiece, and those are vacant lots. And then we are purchasing 2 properties for rehab. One at 17 Buttermilk, and the other one is at 1509 Breckenridge. Both of them are appraised out. So whatever they appraised out for is what we actually offered them. It was a little bit more because we felt like the appraised value was higher, but they both appraised out. One was at 160 and the other was at 225.
Okay. And these are, I take it that this property owner wasn't moving to fix or build on them?
No,
So,
they're actually gonna lose on them.
okay.
Yeah.
Okay. All right. I was just curious. I knew after the tornado, we had some speculators go in there and buy up some lots from some folks that couldn't afford to rebuild. So I guess this is some of the remnants of that.
Yep.
I appreciate the ability to be able to do this. I think the quicker we get stuff rebuilt, the better off we'll be.
Yeah.
Will we bid this out to build houses on them? Or?
Yes,
Okay.
they'll come before you based on what the amount is, and they'll come before you all to vote on. I just want to let Director Peck know that one of these lots are like 2 lots down from the new fire station, and I know we have been having discussion on that because that area is kind of bad. So we want to kind of spur development to allow other people. I know it's been some development going on, but those lots have been vacant for quite some time, and we want to have some improvements.
Thank you.
All right, no problem.
Director Peck, then Director Miller.
Hold on, Kevin. But thank you. And I am aware and I'm delighted this is finally happening. Nothing happens quickly. So my question is, here are the first four projects, basically. And it's almost $21 million. I mean, I know there's some administrative fees. Can you give us any insight on what might be on the horizon for the rest of the money?
Yes, so we do have some other projects that we're using for housing assistance. So we have had some people apply. I can pull up the list for you shortly, but we have had some people apply for housing assistance. They're receiving down payment assistance. Also, we have some people that have submitted rehab projects, people that have some shortfalls dealing with insurance that they did not cover all the rehab of their structure. So there are some things going in the background. This is just some of the bigger projects that we're looking at. And we are working on implementing and open up application for infrastructure projects and improvements right now. So currently, right now, what's in progress, we have 7 applications for pre-eligibility in progress, and then we have 4 that's under review. We have 16 that are in the application progress because we do have the application process open for housing assistance. And then we have 17 that's under review. We have 33 that have been denied because we did have some people that just submitted projects and they didn't meet the criteria of the CDBG requirements. And then we have 2 on the wait list. But we do have projects in place that are going right now for housing assistance. These are just projects that are currently in place for construction.
I would love to have that list because I do get questions periodically from those neighborhoods most impacted, well, especially Walnut Valley, but Colony West and the Sturbridge as well.
Yes.
It's the status, and just so I can speak intelligently about it. And I know it's a big, heavy lift, and I'm excited to see some concrete things happening. So thank you all.
Yes, and they always can go to our website and go to CDBGDR. We provide updates each
There
and
are
every.
updates there? Okay, well then
Yes.
I can do that as well.
All
Okay,
right.
thank you.
But we'll be happy to sit down with you to get you a little bit more
I
detail.
think I can manage to navigate that.
All right.
If I have any questions, I'll let you know.
All right, thank
Thank
you.
you.
Mhm.
Director Miller.
Yes, sir.
Before you leave. Here, let me ask you, since you're using community development block grant funds, you're saying these are gonna be affordable houses. So what's affordable?
So
is-
we did apply for a waiver, and I know everybody was understanding that we did apply for a waiver for housing assistance. We can go up to 150 AMI of the area median income for that area, and then we do have some things that we have to spend a certain percentage, 80% of the area median income. But as far as housing assistance, we can go up to 150, and then it's basically with CDBG DR, it's a little bit different from CDBG. So it's a kind of a numbers game when you're dealing with what you can do in that area. Everybody knows that area is well above 80% of the area median income. So the actual focus is those ones that was affected by the tornado. But we did apply for that waiver and we did receive up to 150 for the housing assistance. Now, construction is a little bit different cost. We may have to subsidize a little bit more to get to that median income, a median sales price in that area.
So, again, it fits in the box
Yes,
for using community development block grant funds,
yes,
since you got a waiver.
yes.
Okay.
Yeah.
Thank you.
All right.
Thank you, Director Howard.
Yes.
Board members, any more questions? Any more questions? Any more? Director Adcock? No, you just one. Yes, ma'am.
Okay, I have a question on 15.
On, we don't have item 15.
Right there. Well, there's a one laying here.
That may be an old one, Director Adcock.
Okay, for some reason, I have a old one laying at my desk. Thank you.
We'll get that corrected.
I would like to have a current one, please. Thank you.
Thank you. Board members, any more questions?
Yes. Is somebody going to make the motion on Tuesday so the vote will be 6 votes instead of 8?
Yes.
Thank you.
You wanna,
What's the item number, Tom? Mayor, I plan on asking for an
It's the
expungement of our vote on item,
Z10303. Yes.
Oakwood. Yeah.
will do.
Oakwood. All
Will-
right.
Will do.
Thank you.
Director Webb? Gotcha. Thank you. All right, meeting adjourned.